Bismillahirrahmanirrahim. We acknowledge the land we're meeting on is in the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. Ya Ali Madad, and good evening, ladies and gentlemen. My name is Ali Molji, and I'm a member on the Economic Planning Board, and I'm honored to be your MC for this evening's event. On behalf of the Aghan Council for Toronto, I would like to warmly welcome you to today's Innovations in Healthcare Gala and Summit. We are thrilled to have you all here to explore and discuss some of the most exciting advancements in healthcare, as well as the pivotal role leadership plays in shaping its future. I hope you've all had a chance to enjoy your dinner and mango shake as well. And I trust you're now ready what promises to be a very insightful and engaging discussion. Our objective tonight is to delve into some of the most pressing issues in healthcare, particularly in the areas of healthcare innovation, artificial intelligence, AI, data science, navigating healthcare careers, and global health equity. This fireside chat will allow us to hear directly from some of the leading experts in these fields, individuals who have dedicated their careers to improving healthcare outcomes on a global scale. Before we begin, I'd like to briefly outline the format of this evening's events. We will kick off shortly with a welcome address by our very own Council for Toronto President Nimira Dhalwani, followed by a fireside chat moderated by Karmali, followed by an interactive Q&A session, and end off with a networking opportunity. We encourage all of you to reflect on the insights being shared and actively participate in the Q&A segment. At this point, it is my great pleasure to invite Nimira Dhalwani, the President of the Council for Toronto, to deliver the welcome remarks. President Nimira is not only a highly respected leader within our community, but also a recognized expert in the healthcare technology field, currently serving as the Chief Technology Officer at SickKids. Please join us on stage to share the welcome remarks by President Nimira. Thank you.
Bismillahirrahmanirrahim. Institutional leaders, Jamaati leadership, esteemed panel members, friends, family, good evening and Ya Ali Madad. We are living the future of healthcare. Many aspects of healthcare are evolving rapidly, and we are already experiencing innovations that were once considered futuristic, with daily headlines about breakthroughs in various areas of human health, ranging from pharmaceuticals to the newest digital innovations to, of course, artificial intelligence, or AI. We are at the cutting edge of healthcare discovery and innovation. Today's conversations could not be more critical as we seek to navigate the new challenges and harness the very real opportunities presented by the intersection of advanced healthcare practices and technology innovations, so we can be ahead of the curve and have better insight on the path forward. I would like to touch on 4 important points today. First, having lived through COVID-19 pandemic, we can all attest to the centrality of health innovation in developing vaccines using novel mRNA technologies and data science applied at the population level that helped identify and manage outbreaks in real time. Similarly, personalized or precision medicine holds the promise for saving life-saving treatments for rare conditions and cancer treatments tailored to each patient's specific genetic, biochemical, and lifestyle makeup. Whether in the fields of epidemiology, healthy aging, or biotechnology, health research plays a pivotal role in advancing health knowledge and enabling knowledge translation from bench to bedside and beyond. Therefore, we must not only be responsible consumers of knowledge, but also do our part in furthering the knowledge societies in which we live, work, and learn. This brings me to my second point of the shifting landscape of tomorrow's healthcare jobs. Are we ready? AI is already disrupting jobs, and young professionals must carefully consider the qualifications that will enable them to future-proof themselves in a competitive job market. With technology now enabling care to be accessed from home, roles in virtual care and digital health solutions are only expanding. Equally, there are opportunities in developing AI models for predictive healthcare, AI-enabled IT infrastructure, cybersecurity, and wearables, just to name a few. These opportunities will require professionals such as research scientists, data scientists, medical device engineers, cybersecurity specialists, and experts in health informatics for operations and maintenance. These are some of the many careers that may likely see increasing demand as technology grows within the healthcare space. Now, my third point. Alongside these new opportunities made possible by health technologies and AI, we will likely also face new ethical dilemmas. A key consideration is ensuring accessibility of modern health technologies around the world. If we look at some stats, about 92% of maternal deaths occurred in low and lower middle income countries in 2023. And most of these could have been prevented with professional medical care. Health outcomes, including the life expectancy and infant mortality, are disproportionately worse in the global south. And there are growing concerns that inequitable access to technology will only widen the gap. Here at home, we witness similar inequity. While digital health services offer convenience and flexibility, they often fail to reach populations who lack access to technology and infrastructure, thereby widening the existing health disparities. As global citizens, we need to think about designing culturally safe digital services and ensuring equitable access at a low cost. My fourth and last point. This is around the significant opportunity we have at this juncture to be of service to society. With health system globally being strained by several forces, whether physical, economic, or geopolitical, new solutions are urgently being sought to ensure reliable health service delivery in not only urban centers, but remote settings, as well as zones stricken by natural and human-made disasters. Technology and AI present a unique opportunity for those of us in the tech space, who perhaps otherwise would not have considered ourselves as potentially having a role in global health, in very much a position to share our professional expertise and making a difference in the lives of individuals, not only locally, but around the world. With that, I look forward to hearing our esteemed panel and gaining insight on how we can think critically about our role within today's healthcare industry, both as consumers as well as difference makers. Thank you.
Thank you, President Saiba, for your inspiring words and for all the incredible work you continue to do for our community. Thank you. Now, it is my honor to introduce the distinguished individuals who will be sharing their experiences and insights with us tonight. Let me start by introducing Karmali, our moderator for the evening. Kamal is a national correspondent for CTV News, where he covers major national and international stories. Known for his deep understanding of complex issues, Kamal has built a reputation for insightful and engaging reporting. Additionally, Kamal has also volunteered for the Aga Khan Development Network, filming developmental projects in Mozambique, northern Pakistan, Tanzania, and has also taught at the University of Central Asia. Please join me in welcoming Kamal to the stage as we invite him to take a seat. Next, it is my pleasure to introduce our first panelist, Asmita Gillani. Asmita is a seasoned executive with over 25 years of experience in healthcare leadership. She has served as the former CEO of the Aga Khan University Hospital, where she played a crucial role in transforming the hospital into a world-class academic medical center. She has also led the expansion of healthcare services to sub-Saharan Africa. Currently, Asmita is the interim CEO at the Yeong Center for Geriatric Care. Asmita's leadership and vision have made her a key figure in healthcare innovation and organizational growth. Additionally, Asmita has also previously served as a member of the Leaders International Forum, LIF, the Vice President for the Aga Khan Council for Canada, and the National Chair of the Health Board and Social Welfare Board for the Aga Khan Council for Canada. Please welcome Asmita Gillani to the stage and invite her to take her seat. Thank you. Next, it is our pleasure to introduce our very own headquarters Mukhi Sahib, Dr. Mamdani. Dr. Mamdani is the Vice President, Data Science and Advanced Analytics at Unity Health Toronto and a professor at the University of Toronto. Dr. Mamdani is widely recognized for his groundbreaking work at the intersection of AI, data science, and healthcare. He has published over 600 studies in peer-reviewed journals, placing him among the top 1% of scientists worldwide. Dr. Mamdani's contributions are helping to shape the future of healthcare by integrating data-driven approaches into clinical decision-making. Additionally, Dr. Mamdani has previously served as the National Chair of the Health Board for the Aga Khan Council for Canada, and as well as member of the Aga Khan Education Board for Canada. Please welcome Dr. Mamdani to the stage as we invite him to take a seat. Lastly, it is my pleasure to introduce Karima Karmali. Karima Karmali is an experienced healthcare leader with over 35 years of experience in healthcare operations and leadership. She recently retired from her role as inaugural director of the Center for Innovation and Excellence in Child and Family-Centered Care at SickKids. Karima's work at SickKids has had a profound impact on pediatric care with their development of the SickKids model for child and family-centered care, which has now been adopted internationally. In addition to her work at SickKids, Karima currently serves as the chair of the board of directors for the Ronald McDonald House Charities Canada. Additionally, Karima is responsible for the Global Poverty Elimination Agenda on the Secretariat of the Leaders International Forum, LIF, and has previously served as the Vice President for the Aga Khan Council for Canada, and as well as the National Chair of the Health Board for the Aga Khan Council for Canada. Please join me in welcoming Karima to the stage and inviting her to take her seat. And now, with our esteemed panelists in place, it is my privilege to pass the floor to our moderator for the evening, Kamil, who will guide us through tonight's fireside chat. Kamil, over to you.
Okay, thank you so much, Ali. I did not know that intro was happening. That's a lot of pressure. How do you guys feel after hearing all of that?
More pressure for us.
Yeah, more pressure on you, right? Not so much on me. Okay, thank you so much for being here, all three of you. These three you just heard there are the rock stars of their field. Now, when they stepped up to the stage, I heard some polite clapping, but I think we should treat them like the rock stars they are. Can I just get a sense of appreciation for these three amazing individuals spending their time here? Give it up for Asmita, Mohammed, and Karima. And Mohammed gave me permission to call him Mohammed. Everyone else must call him Muki-side, just FYI. I was given special permission. Okay, so the topic tonight is about healthcare innovation and leadership, where the field of healthcare is going, what are the latest advancements, and how you can learn from it and take advantage of it. So you don't need me to introduce these fine individuals again. They are incredibly well-established in their fields, well-renowned. But why don't, Ali spoke a little bit about you three. I've gotten the crowd all riled up.
No kidding.
Why don't you three take it away in terms of how you would like to describe yourselves in terms of what brought you into this field, what inspired you to enter into the fields that you're in? Asmita, why don't we start with you?
Okay, no pressure. I mean, I'm looking for the fire here, So I was told to speak about my journey, which being so old is very long, so I'm going to really truncate it to the key pieces. I think, first of all, it's incredible to see this crowd, and thank you for making the time. It's a Friday night, late, so I really appreciate it. And I want to also say that honestly and truly, all of you have unique journeys, life journeys, and there is nothing extraordinary or remarkable about my journey. So I'm really happy to share it, but I want to really put a caveat that there are some significantly accomplished people in this room, because I know some of them. So I will just tell you my modest beginnings were, of course, in Africa. And I think most of you who've been brought up in Africa, at least in the primary education, were deeply steeped in community, in service, in ethics, in integrity. So we had a very good foundation. And I think that is really the core thing that you have to hang on to. And as it was the case in post-colonial Africa, most middle-class children were sent off to England or wherever for higher education and tertiary education, and I was amongst them, and went to England. I did my A-levels there, etc. And I picked the easiest entry into university, because in England you go to university at 17 and you graduated in 3 years with honors degrees, so I figured that's a pretty good path for me. And I took up the easiest entry, which was microbiology, infectious disease, and then, came to Canada, got married at a very young age, etc. Came to Canada, landed at Toronto General Hospital, and because in those days, only the teaching hospitals had virology, and little did I know that this little virus that I was so adapted, growing and researching, would one day shake the whole world. With the pandemic. So it was, something that never entered my psyche, nor did it enter anybody else's for that matter. Anyway, to cut a very long story short, from there I went to do my MBA at U of T, and then I was into the community services, doing voluntary work. And I think this is where your professional life and your voluntary life interacts, because at the time, after I did my stint in Social Welfare Board and Health Board, I ended up as vice president. And that's when we met Hazimam Shah Karim very, very often, because at that time, this building was being built with Charles Correa. The museum was being built with Fuma Hikamaki, who was also doing the delegation building. And we were also converting the War Museum into the Institute of Pluralism. Those 4 projects were during our leadership time when I was vice president. So Hazimam was coming very often on private visits. And of course, he learned about me, and he said to me, Ismira, would you go to Dar es Salaam and give me a candid report on what's going on there? So I was still doing, I was still a CEO at McKinsey Health, and I went to Dar es Salaam, did a report. Little did I know what he had in mind. So when the appointments meeting came, when my vice president stint was over, at the appointment meeting, Hazimam said to me, will you join my network? I need people like you. So the die was cast, and before I knew it, I was shipped off to Nairobi to run the Aga Khan University Hospital. I have to tell you, the 6-7 years that we spent with Hazimam were the most inspiring learning experiences anybody, any school or any PhD could give me. And when I took on the Nairobi job, he came to see me right away, almost 2 weeks after, and I said, Hazimam, I'm very nervous about you coming, and he said, all the more better. Anyway, and that's my story. I came back and then took over the Accreditation Canada. I was the executive head of Accreditation Canada. I retired, and then I was asked to lead the Yi Hong Center. That's my story. I'm so sorry it's so long.
And we'll touch more on volunteerism later.
Yes.
There's a couple of questions on that, but one thing I've learned about Asmita in talking to her a little bit, she is very modest. So that was a very modest way to put it as well. Dr. Mohammed Muki Saib Mamdani, Triple M as we call you, as I can call you.
Thank you. Actually, I want to hear Asmita talk more, but I'll kind of try and keep mine a bit short, but I'm going to tell you a bit of a story. I'm going to fast forward through all of the childhood stuff and go to where I got out of school and had my first job. I was feeling pretty good, very confident, bit arrogant, thinking...
Why are you looking at me when you say that? You look directly at me.
Really confident.
Yeah. Okay.
I'm sharing the love. So I figured I've just finished school. My first job was at Sunnybrook and ICES, which is a big research center. And I remember I was sitting one day and I was thinking, I'm such an amazing researcher. I'm so fantastic. The first paper that I ever published, I bet it's cited 1 billion times. And everyone's listening to the work that I've done. So 4 years it's been since I published my first paper, and I did a citation search because, I needed to feed my ego. So I do the citation search, and I click the button, and I'm ready for 1 billion. There was one person who had cited my work in the past 4 years.
Wow.
And I was so depressed. I said, who's this idiot who cited my work? And I clicked, and it was me in another paper. So you can imagine I needed therapy at that point, right? So I go to my boss at the time. His name was David Naylor.
I know.
You probably know David,
Yeah.
yes. David was...
He was AKU board member.
Yes. So David he became the Dean of Medicine at University of Toronto. He became the President of University of Toronto. He's a pretty prolific person. And I said to David, David, this is awful. I have no impact with the work that I'm doing. I'm doing clinical work, but I'm also doing research, and my research is supposed to go to the masses. And he says, all right, why don't I look at your paper? And he looks at my paper and he says, this is really bad. I said, I thought that was amazing. And he goes, no, your methods are great. The science is fantastic, but you picked a really bad question. And he said, you're not alone. the vast majority of papers that are published out there actually have no clinical relevance. So the one thing that he said to me was, think about your purpose. Think about your purpose. Why are you doing the work that you're doing? And I said to him, you know, I want to help people. I want to impact care. And he said, then pick the right questions. Pick things that matter to people. Do things that matter to people. And that shaped the rest of my career.
Very good.
What a great story.
Karima, Karmali? No relation, by the way.
That's right. Yeah, first of all, thank you everyone for coming out tonight. Real pleasure to be with all of you. And I hope that some of what we have to share tonight helps you in your own journeys, and particularly those of you who are just starting out in the healthcare field or are going to be entering the healthcare field. My journey, so, you know, the first thing I would say is my journey was not a linear journey by any means, was full of twists and turns. And I would say that it began when I graduated with a Bachelor of Science in Nursing from McGill University in the late 80s, and I'm dating myself here. Upon graduation, came back to Toronto and started work at the University Health Network. This is before all the mergers in healthcare happened. So Toronto Western, Asmita remembers, Toronto General. Did a number of different things at the hospital while I was there, starting with clinical practice and then moving on into leadership roles in clinical operations, into professional practice, and informatics, actually, when informatics was just starting as a field. And the other thing that was really fantastic during my time at UHN is that I was given the flexibility to actually take off for extended periods of time to travel. And that's because I was really, really passionate about seeing the world, did a lot of backpacking in those days through Africa and Europe and other places. And landed in Tajikistan for about a period of a year, doing work with the AKDN, and this was just after the collapse of the Soviet Union. So really interesting times in the stands, you know, during that period. And, you know, I mention those things because I really think that those experiences actually had a huge impact on me as an individual. I think they really helped actually shape who I am today, and also I'm sure had an influence on some of the career choices and other life choices that I made during my life. When I got back, I shifted gears, left the academic health science milieu, and went to the WSIB, which is the Workplace Safety and Insurance Board of Ontario, as a healthcare consultant, because they were doing some really big and nifty things there. So helped lead some of the transformational change related specifically to healthcare there, and held a number of different positions, including chief of nursing. When, when I finished my MBA during that period, I found myself really missing the academic health, science, sort of environment, big hospital. When I was approached by SickKids to join the leadership team there, I decided I hadn't done pediatric care and wanted to try that. And I'm so happy that I did because, one thing I've learned at my time, through my time at SickKids, is that children are absolutely amazing. We have so much that we can learn from them. They are so resilient even through the most difficult times in their lives. And they can live through pain and, devastating diagnosis and still be smiling and happy. It's just amazing. Anyways, I found that really inspiring. I recently retired from SickKids and decided to take a year just to think about other passions and pursuits and really pay a lot of attention to my volunteer work. I'm currently, as you heard, the chair of the Ronald McDonald House Charities Board for Canada, and I'm also leading some of the LIF work because the poverty elimination work is very close to my heart. And like Asmita, shot Kareem during my time on the National Council and as Vice President at the end of my term had asked if I could help lead some of those efforts globally. And so that's sort of my focus right now. Sorry, not as short as I wanted to be. Sorry,
No, it's quite the journey, all three of you. Thank you so much. And we're so lucky that all three of you are spending your evening with us. We have a lot to squeeze into an hour, so we're going to try to get in as much as possible. So we'll start off with the topic of transformation. And Karima, we'll stick with you with your role at SickKids, because you developed the SickKids model for child and family-centered care. It's now been adopted internationally as well. And so what was the driving force in creating that? I mean, that is something that was sort of created here, but then picked up around the world. What was the key in being able to build that?
Well, one of my mandates at SickKids was to actually establish the Center for Excellence to advance child and family-centered care and really bring about a transformation in the culture of the hospital to put patients and families first. And 10 years ago, that was really a new thing. Not a lot of people were talking about it. SickKids really wanted to be a world leader in this particular space. And so those were sort of the driving forces. As I embarked on that work, it meant really talking to stakeholders from across the enterprise, frontline nurses, physicians, healthcare leaders, folks in our research institute, scientists, and people in the Learning Institute. And of course, patients and families themselves. And one of the things that became really evident as we did that work is that although we threw around the language of child and family-centered care, or patient and family-centered care, people didn't really understand what it meant. When you got into deep conversations,
how would you define it quickly for those who might not know?
Sure, there was an unevenness in understanding. I would say that what patient and family-centered care means is that you plan care to meet the needs of patients and families as they define them, ensuring that you're focusing on things like respecting their decisions, partnering with them in decision-making, and being really, really clear communicators with them. And those things are important for patients, but sometimes healthcare professionals, when they're really busy, forget those things. And so when the model was developed, and we had no idea it would be picked up in so many places, but pretty soon after we started to present at different conferences, we started to get calls from university professors who wanted to integrate the model into their curriculum, and from hospitals who wanted to adopt it in their places. And I know within SickKids, I think it really changed the culture of the organization in terms of just even measuring whether or not we started to measure whether or not the care we were delivering was patient and family-centric, which was a new thing.
Okay, so very quickly, what was the one thing that that model had that nothing else had at that time around the world?
Well, there weren't any models. I think that's what I would say is that, people, even though people talked about the concept, people didn't really understand it and needed the lexicon, if you will, to be able to speak to it. And if you can't define it, then it's actually really hard to practice it.
Thank you so much, Karima. Asmita, moving to you with the topic of transformation, your transformational change that you facilitated with the Aga Khan University Hospital from a community hospital into a major academic medical center was remarkable. So what was the key behind that transformation? How did you turn a community hospital into a global, state-of-the-art, well-renowned medical center?
So first of all, I would say that it's still work in progress. I think it's an aspiration. But again, I have to say that it wasn't the genius on my part at all. I was incredibly fortunate to have constant guidance. I mean, we were meeting with Hazimam 3 times a year minimum. And then, of course, the children were coming all the time. All the time we were getting nuggets of how to go about it. And there were really three levers that he, left us with. He said, start with postgraduate education, PGME, postgraduate medical education. Don't start with undergrad medical education. It's costly, and the benefits. Hazmam was a paka businessman as well, I should say. And he said, because postgrads, your residents, they are actually earning, they're doing a service, so it doesn't hit the budget as much because they're actually seeing patients. The other thing that they did was they brought in a level of inquiry which was non-threatening, because we had all these hot-headed physicians, present company accepted, who were in private practice, didn't subscribe to academic medicine, and to bring postgrads in, they would open up lines of inquiry which would be non-threatening, and it would be around quality. And I'll give you an example. If somebody had a crack after post-surgical knee replacement, in the prosthesis, they would ask, how could we have done this differently? What could have happened, rather than you made an error, So it was the genius of Hazimam's guidance, really, that we started with PGME. We started in about 6 disciplines. And that started to change the psyche of the physicians, because now they are belonging to an academic institution that put up their cachet quite a bit. The other thing he said is go and pursue an external validation of quality. Pick the highest standard of quality and get that credential, which was in those days JCI, the Gold Seal of Joint Commission out of Chicago, USA. It was an incredibly high bar. When I came to AKU Nairobi, and I gave Hazimam a 2-page report, and he said, this is the first time somebody has spoken so candidly to me, because there were transcription errors, there were medical malpractice, I couldn't sleep at night, okay? And he said, bring the highest quality. There were 1,780 measuring elements that we had to pass by this commission that came in. It took us 2 years, and Zinat Suleiman, who is now the regional CEO in East Africa, she was my chief nursing officer. I said, Zinat, go wild, do whatever. I personally went on floors to check crash cards to see if the right medications were there, if there were expired bottles. We got the gold seal after 2 years, and I have to digress and tell you a little story. It was the first university hospital, the first hospital in sub-Sahara Africa to get JCI. And I will tell you a little story. Our accreditation decision came at 4 o'clock in the afternoon, Nairobi time on Friday. I phoned Firoz, who was the president of AKU. I said, Firoz, we got it. He called Hazimam. Next morning, I get a message from Hazimam, and he said, Asmita, I want you to put gold letters and hang them, because you've done it, So the next day, we had a big session in the lecture room. Firoz flew in, and we gathered all the staff, and we read Hazimam's message. It was an incredible, incredible achievement. Again, through guidance. I have still kept that letter.
I'm sure.
It's, the attention to quality. When I first took the job, and when, Hazimam said, you understand international standards. I want my institutions to be having the best practices. That best practice mindset has stayed with me throughout my life. Anything you do it with gusto, do it with commitment, do it with the best you can, no matter how trivial it might be. Just do it. Occupy that space that nobody wants, and do it well. That builds your reputation. That will open doors for you. And that is something that I think we all have to espouse. Best practice, combined with, of course, I could go on and on, but I'll stop. I'll let
Great
somebody
lesson.
else speak.
Great lesson.
I
Okay.
still want to hear her talk more.
Yeah, I want to hear all three of you talk more, but these kind people were here spending their Friday night with us, and I'm sure they want to go to bed at some point. But let me take a quick survey here. How many of you are here, put your hand up if you're here, primarily to hear about artificial intelligence in health? Okay, wow, quite a few hands. Mohammed, no pressure. No pressure. This next one's for you.
Soon, but
Sorry?
I'm going to faint soon, but that's okay.
Yeah, that's okay. You called me arrogant. I'm gonna keep you here for as long as I want. So you're working at the forefront of artificial intelligence in healthcare, doing some of the most important, groundbreaking work. I have a couple of questions for you. One, if you could tell the audience one thing that they should know about the future of AI in healthcare, one thing that, might give them a hint as to where the field is going, or something to maybe even spark a bit of hope, something that might stick with them. And then the second part of the question is it important to keep the human element, and why? Because AI has been divisive. It's been good, but there's been elements that's been bad. Is it important to keep the human element, and why?
Mm-hmm. Yeah, I think if it was one thing that I could say to people who are interested in this space, I would say it's no longer something that is talked about. It's no longer some theoretical construct, because we've seen the failures in the past, right? And in the past, the AI wasn't so much the issue, it was our technological ability to store and process data. We now have that. So this is a reality. And what do I mean by a reality? At my own hospital, we created certainly Canada's first AI program, Flight AI program, and I think it was the first in the world, when people were saying, this is just a dream, it's never going to happen. How do you actually apply it to healthcare? So if you walk into our hospital, you will see over 50 AI solutions running. Just as one example, we have an AI solution that monitors our patients in the internal medicine unit. We've now expanded to surgery and launched it in another hospital as well. This AI runs in the background and it monitors our patients. Every hour on the hour, it's monitoring our patients. It typically pulls in 150 to 170 different parameters, from demographics, lab results, vital signs. And what it does is it predicts if somebody's going to die or go to the ICU in the next 48 hours.
Wow.
Now, as soon as it reaches a high-risk threshold, it pages the medical team. It pages the palliative care team. It pages the critical care team. So all the physicians know, all the nurses know. Our protocols, they have to go and see the patient within an hour of being paged.
Sorry, how is it detecting this? Is it a scan?
It's an AI model that basically has been trained on over 20,000 patients worth of data. So it's learned all sorts of patterns around what are the patterns that I'm going to look for before a patient dies so I can alert our clinical teams.
Wow.
And we published our paper in the Canadian Medical Association Journal.
I read it.
In September, yes. We saw a 26% reduction in expected mortality.
Wow.
So these are not... Thank you. So these are not hypotheticals anymore. This is how we actually run as a hospital. This is coming. So I would say that this is going to be a new reality. What we're going to be seeing, what I've seen, I was in Shenzhen, China, just a couple of months ago. They're pretty aggressive there. And how they've been able to deploy some things really will make you think. This is where the future is going. Now, the human element. Mm-hmm. You know, if you asked me this a few years ago, I would say it won't replace humans. It won't take your jobs. It will take your jobs.
Wow.
Absolutely.
I said spark a little hope.
Yeah. Now that being said, sorry, I misread. That being said, it's going to force us to do better, right? We're working on a project right now where we have a team of medical coders, over 30 of them. It's awkward because our organization has asked us to build a tool, and 2 of the medical coders are on the team building a tool that will replace their jobs. That team will be cut at least by half.
Wow.
It's a reality because they're doing things that AI can easily do better, faster, cheaper. We've actually looked at it to say what one person can do in 3 months, AI will be able to do in about 12 seconds with greater accuracy. Right. So it's coming, but what it will do is it will force you to ask yourselves, what else can I do? How can I upskill? Right? And that will open up a lot of opportunities for us to do much more impactful things rather than sitting and doing rote, mundane things that a machine can do fairly easily.
Yeah.
So I would say the human element is still going to be there. We will still have to make ethical issues. There are going to be more and more centers around responsible AI. So I'm just going to go on one other thing around this because it is relevant. 2 years ago, there was a gentleman in Belgium who was chatting with a chatbot. And the chatbot is an AI thing. It seems like it's a human. You can easily believe it is a human, but it's not. It started to what's called hallucinate. It would make up things. So it told him that his wife and children were dead.
Wow.
It told him that the chatbot loves him more than his wife does. And it told him that if he took his life, that would save the planet. So he committed suicide.
Oh my God.
Yes. A few months ago in Florida, because in the New York Times, a teenager committed suicide after chatting with the chatbot on character.ai.
That's right.
We see many more of these cases now. So without control, without the human element, without us directing it, it can cause significant harm rather than help society. And that's where I think we have to keep our fingers on the pulse as a society and basically guide it to say, we're going to build you in a responsible, effective way to help rather than harm.
Mm-hmm. Thank you for that. That was very insightful, encouraging, but also,
A little scary.
Yeah, a little scary. You took the words out of my mouth. So we do want to get to a pretty robust Q&A session, so we're fast tracking through a few of the questions here. But one thing that we all four feel like needs to be discussed is health equity and health accessibility. This is a problem that has persisted throughout Canada. You know, the healthcare system called broken for the past few decades, I would say. But you guys are the experts. So Asmita, let's start off with you. I mean, you worked with Aga Khan University Health Services in Sub-Saharan Africa. Your work now with the Yi Hong Center for Geriatric Care is rooted in health equity. So through your experiences, how do you make new advances in healthcare accessible to all?
Yeah, I think I'll start off, but I think Karima also has some really great work in, you know, the whole poverty elimination as well. I have to say that in Africa, whether you call it AI or just, you know, digital technology has been a real game changer. It has democratized knowledge. What do I mean by that? It's a mouthful, okay. Access has improved dramatically because of digitalization of health knowledge. And I'll tell you, for instance, Africa and all other developing countries, they don't have the legacy system of cables and all that. They went straight to mobile. They don't have to worry about landlines because there aren't any, okay? So they went straight into mobile technology. And M-Pesa, for instance, those of you who are in the financial field know that transactions were happening in Africa way before they came here. And we found, for instance, that in the most rural, remote places in Africa, where midwives do birthing, mostly all births are done by midwives, our third-year and fourth-year residents could actually instruct midwives through digital interconnection if there was a difficult birth happening. So they could actually provide, you know, very sound advice in time, at the time, and that saved children. So that was one thing. When we built the biggest, well, not the biggest, but the most comprehensive heart and cancer center in Nairobi, our first cath lab, our first cath procedure was actually supervised by University of Alberta. Our physicians were doing the cathing in the cath lab, and it was being watched over by U of A in Alberta. And they were actually supervising our residents. That was the power of bringing incredible tertiary knowledge, not just to us and our residents. I mean, radiology digitalization was very, very common. Like even today, a lot of the scans are read remotely. You probably know that, right? All the lab work is done remotely. Even reading slides is done remotely. So there is a lot of equalization happening. You know, a lot of kind of access is improving because of technology. But I have to just pick up on what you said, Mukasai. AI without empathy is vacuous. You know, it has no meaning. So that element, healthcare professionals go into healthcare primarily because they have a calling. They want to, you know, improve lives. They want to help people. That empathy, if it's lost, then we'll all be victims of mindless, senseless AI. And I think that's one thing that humanity within us needs to be constantly manifest itself. Otherwise, God help us, you know.
Can I just add? Sorry.
Yeah.
Can I just add to that? You know, I completely agree with you, Asmita. I think, you know, in the era of AI, there is a huge risk to us actually losing the human elements, and those human elements are, you know, caring with compassion and empathy. So I think that we as healthcare professionals and the general public really have to guard against that and actually hold healthcare professionals accountable for the care that they're providing. And so I think it's going to take super efforts to actually keep the focus on the human elements. And I think it behooves us as leaders in healthcare to make sure that we don't lose that focus.
Mm-hmm. Mohammed, you had a point as well?
Yeah, I do. I'm going to challenge a little bit.
Go for it.
Yeah, and the reason why I challenge
It's getting hot up in here.
No, what's going to happen...
Hide sleeves out.
What's going to happen is we're going to have to up our game as healthcare professionals to be more empathetic. Because yes. I'll tell you, how many people have actually been to a physician with poor bedside manner?
All the time.
Why? Why are they treating you like that? Should they? Where is the empathy? We have to be more empathetic. There's a paper that was published in JAMA Network Open.
By Duke University?
Yes. And what they're able to show was, what they did was something really simple. They said there's a public forum where patients' questions get answered. Who answers their questions? Physicians answer their questions. Somebody had a brilliant idea. They said, you know what, why don't we get AI, ChatGPT, to answer their questions instead? And we'll actually code it so that it perceives to be empathetic and such, so it gives you empathetic answers. What they found was that patients who were randomized to get the physician responses versus the AI responses, the rating of good to excellent response was 3 to 4 times higher for the AI than it was for the doctor. When they looked at empathy, the patients rated it 3 or 4 times higher, more empathetic than the doctors. Why? Because if you think about it, doctors are busy. They'll give you a one-word answer, maybe one sentence if you're lucky. They have other things to do. AI has all the time in the world. Yeah. It will give you a long, verbose, beautiful answer. It'll say the exact same thing, but it'll make it seem like it cares. So you feel it's more empathetic. It takes the time that humans don't have. So I would suggest we need to up our game.
Absolutely.
And a lot of these empathies are simulated, right? Like they're not real. So there will come a point where the AI will struggle with empathy. I think it's going to be difficult to differentiate when in the future. And we have to kind of keep watching how it grows, gets better and better, and we need to become more human ourselves.
We need to have another one of these sessions that's a few hours long because we do want to go into the Q&A segment, but I wanted to know if either of you, or maybe all three of you, have a quick line or a quick answer to a problem that's persisting in Canada, which is health equity and accessibility. I know we have to get to the Q&A portion, but do you guys have a one-sentence answer to a problem that big?
So Kama, you're asking for a magic bullet answer to a problem that is huge.
I'm a journalist, that's what I do.
Yes,
Give me a
I can
soundbite.
see that. Well, you know what, I would just say that accessibility, we all know, you read the papers, or if you're in healthcare, you see it every day. We've got long wait times in hospitals. We have long wait times in emergency departments. 1 out of 5, I think, Canadians doesn't have a primary care provider. It's a huge issue. What I would also say, though, is that when you look at what's at the root cause, there's many factors that contribute to the issues around accessibility. And I think we really need to tackle those issues. You know, I'm a really firm believer in the universal healthcare system because it, generally speaking, is supposed to be designed to provide accessible care and equitable care to all. And I think it's part of our Canadian identity. It's certainly something that I'm really proud of and would go up to bat to try and protect it. So I think it's important for us to understand those issues and think about how we can solve for the issues. You know, health human resources, we have a shortage. We know that. The complexity of care is growing exponentially with more machines around a patient. We know that hospitals don't have enough beds. Long-term care, you know, from Asmita, I think Asmita was saying there's a wait list of 7,000 at the institution where she works. But I would say at the core of some of this is the fragmentation across our healthcare system, from primary care to acute care to community care to long-term care. And some of that is compounded by the fact that still today in Ontario, we do not have a unified, single electronic healthcare record. That means there's no data sharing across those systems. That makes transitions from one part of the system to the next really, really difficult. And, you know, there isn't a magic bullet. There is no single solution. You know, systems theory, complexity science tells us that systems are interconnected, and you really need to look at layering interventions to solve for the issue. And given the complexity of the issues, I think, in the healthcare system, it will require like very big L leadership in order to actually tackle the problems. And I would say it's really the leaders of tomorrow that will help us, need to help us to get to the solutions.
Great answer, thank you. Do either of you want to pick up on that?
Well, I would say a couple of things. I think that we have invested so much in what I call the sickness system, right? It is the biggest part of the treasury. The amount we spend on hospitals and physicians, there is no country that can sustain this level of spending. And we pay 50, 60, some of us pay 50, 60% tax, right? So where is the money going to come from? So just by definition, there has to be rationalization of healthcare. Otherwise, you can't service everybody. And there are people like me, the worried well, that will run to the doctor for one headache or whatever, right? So you have all those forces. And I think one of the things that we don't focus too much on is prevention. It's our lifestyles. It is healthy eating. It's what your mothers always told you: eat well, eat, you know, improve your nutrition, sleep well, exercise, have an inner resilience, you know, seek your spirituality so that you are balanced, you know. That there is zero attention. We eat very highly processed foods. Everybody is on the run. We're eating like McDonald's or whatever, fast food. All that then results in this. right?
There goes
So
my
I
Big
think-
Mac tonight.
Yeah, I know.
And the other comment I would say, you know, I used to go to the doctor and he'd say, Asmita, you're coming for a second opinion because you've already researched, right? And I said, yes. And I think that part is going to get more and more prominent. People are going to look up their own diagnoses, you know, and it's only the complexity in how you manage multiple comorbidities that's going to present to the physicians, because people are fed up of, you know, and people are savvy. The young people, I know I have children and they couldn't be bothered to go to the doctor, you know, and they don't want to wait. And they are looking for private sources because they are fed up of the system, right? So I think it's something that we're not going to be able to hang on to. There are going to be other forces that are going to act upon us, and we'll have to make room for it. So that, like every developed country in Europe, everywhere has a private system. It takes the pressure of the public system. You know, I come from England. There's the very robust NHS, but there's a whole other private system. It sifts out people who can afford and creates space and capacity. Yeah. And I think that moment is coming here, Karima.
Yeah.
I see
It's
it.
worrisome, isn't it? Absolutely.
But there isn't a tax base to sustain.
Yeah.
Because medical technology, medical pharmaceuticals are advancing and are so expensive.
Yeah.
One cancer drug is now, you know, $3,000,
Yeah.
$4,000.
The only thing I would say to that, Asmita, is, you know, when I think about what's coming in the future, I mean, Mamdani's kind of talked about a lot of that, whether it's predictive analytics, precision medicine. You hope that in the next 5 years, I mean, given the pace of change, the pace of innovation that's happening in the system right now, you hope that within the next 5 years we get it to that level where it's actually saving us money. So our system is complex, but I do think there are solutions that we need to apply in a really thoughtful, intentional, deliberate way to get us to a place where we are actually seeing the system transform, and so that there is more focus on prevention instead of, you know, the tertiary and quaternary care which we get to right now. So I agree with you, there needs to be more focus on prevention. But I think we'll need to differ on sort of, you know, private versus public, because I just feel, you know, very passionate about the public system and the whole notion of equity, because there are, you know, who gets left behind, you know, when there are different systems. It's the poor, people who can't afford the private care. And we're seeing that already in Canada, right? We're starting to see that. So. I just think that the universal healthcare system is something that I'm certainly really proud of, and it's something that we should try and defend.
I'm very much in favor of a national system completely. Yeah. I'm saying sift out those who can afford and make room for those who can't afford.
So, you know, one of the things that's happening is healthcare professionals leave from public systems to private systems, right? So it creates a whole bunch of other issues, and it's like a domino effect.
Yeah, absolutely. Yeah, it's definitely seeing a ripple effect. Mama, did you want to add anything to that?
I was just enjoying this
self-diagnosis.
conversation.
I was just nodding too.
No, but I mean, I worked in the Aga Khan system, which is a private system, you know, and you're beholden to insurance companies. But, you know, and these are Hazimam's words. He said, I'm not building edifices just to serve the rich. So we had a very, very robust patient welfare program that just catered for the poor. And we actually, you know, would have 2 or 3 days for radiation therapy that was just targeted to the poor population.
Can I ask you, would either of you advocate for a hybrid public-private model? Is that part of the solution? That's what you're saying, Karima, but you're saying...
I guess what I'm saying is that I have concerns about that because it leads to a whole bunch of other inequities and perhaps unintended sort of consequences. So if we do go down that path, and I think we're already there, honestly, I just feel we have to ensure that people who really need the care in the public system are getting the same care level as people who have the dollars to actually seek out, you know, private care.
Thank you so much. Everyone, please give a round of applause for our wonderful panelists here. I hope you found that as insightful as I did, but we're also going to take some questions from the crowd now. We're supposed to have a microphone, so I did not practice that part. That's over there. Okay, in the back there, we got a couple. And so if you have a question, please put your hand up and introduce yourself, tell us your name, and then who you are asking the question to. So we see a person back there in the red, and please introduce yourself and tell us who this question is for.
Good evening, everyone. Thank you for the panel. My name is Farine Wali Mahmoud. I'm in the digital health space, so my question is actually for all three of you. Hopefully, we'll be able to get to all of you. My question is about patient empowerment. So we talked a lot about what AI will do for our providers, our clinicians, all of that, but let's talk about patients having access to their own health data. We talked about a lack of interoperability where we don't have electronic health records that speak to one another. So even in Canada, so in a provincial, in Ontario, in Canada at large, or even on an international scale, what are your thoughts on the importance of that? And how, will it actually be a reality given that we have a very fragmented, siloed system at large? So including the Canadian side, your experiences in Tajikistan, yours is in Africa at large. So hoping to get your insight on that piece. Thank you.
Happy to start us off if you want. I do think that patient empowerment is really, really important. And I think actually we're in an age in Canada, North America, I would say. I don't know about places like, the African continent. But in Canada, for the last 10 years, there's been a whole bunch of work that's been done to build put in place the building blocks for patient and family empowerment so that they are better equipped to help make decisions in the healthcare system. And they are starting to have access actually to their own data. So many hospitals, for example, SickKids included, Sunnybrook, have patient portals where you can go in and access your own information in the chart for that particular hospital. Sometimes you'll find other information from other systems as well, but the data sharing, I think, is not optimal, and there's still a long ways to go. But I do think we're absolutely moving in that direction, and I hope that digital transformation, supported by AI and so on, will help us get there just a little bit faster so that we have complete access.
Maybe I'll add to that. I'm all about patient empowerment. There's flip sides to this though, right? So for the clinical people who are here, how many people love those patients who come in with their long Google list of everything they've Googled? How much time do you spend on that, right? What I worry about a patient, and we're inching our way towards that, right? Because a lot of us have MyChart accounts, so we can actually kind of go in and learn a little bit more. One of the big problems that we have with patient empowerment is that patients are left to fend for themselves in a really unfortunate way, because while there is a lot of information out there, there's a lot of bad information out there. And so how do you actually get good, credible information in a manner that is understandable to patients to empower them in the right way? That's what I think we struggle with quite a bit now. Because for people who actually go onto MyChart, how much of it can you understand? A lot of it is so technical. They don't really make it easy, right? So, and I think technology is coming. So for example, we've got a grant in with Google that hopefully we'll hear from soon around an AI bot that will be fully accessible to patients. And what it will do is it will actually go into your patient records. It'll learn everything about you. It'll have access to the latest randomized trials, clinical guidelines. It'll have access to cutting edge information. And it will know that you're at a grade 6 level and you speak Mandarin. And it will tell you everything you need to know in grade 6 level Mandarin. It'll make it accessible to patients. That's in a way that you actually have credible information that's relevant, but it will also be smart enough to tell you, I'm going to tell you things that you probably will know more than your physician about, but your physician ultimately is the one that you should be talking to. And here's what I don't know. It's time for you to talk to your doctor and have a meaningful conversation. We have to create it in a way that's accessible to patients, that's responsible, and that shifts decision-making at the right time to the right people. I'm convinced it'll come. just may take a bit of time.
Asmita?
No, I was just going to say that what I fear about is misinformation.
Yes.
You know, what I worry about is that the interceptions that can happen on good data and then completely corrupts it and gives you, like the guy that committed suicide or whatever, right? I mean, you could have these intersections and disruptions coming in because, it's not a human interaction. It's a digital interaction. You don't know, the authenticity of it. So that's something we have to really watch for, because with all this information floating, there is real risk of misinformation.
The one good thing about patient portals, if I can just say, and I think the young lady back there was talking about sort of access to your own information. The one good thing about patient portals is that the information in your own chart is coming from the true source, right? It's coming from healthcare providers who are treating you. So, I do think there's a lot of value in patients having access to their own information. I think it empowers them to participate in decision-making about their own care. So I think it's actually really crucial.
Yeah, because Asmita, you were saying that you come in with your own information as well, and you said it's going in that direction, right?
It is going in that.
We're going to take another question just because we're also running out of time. So anybody else have a question back there?
My name is Dilshad Pirani, and I am in Canada for last 25 years, sorry. I'm AQ grad. So thank you very much for this panel. Recently, I attended the conference for Nursing Leadership on Network Ontario, and that's where we talked about AI. And very interesting question which came is, AI is based on data, right? Now, there's so much goes on in healthcare, patient-centered care, end-of-life decision, comfort care, so much like an arts part, not a nursing science or medical science, but arts, which does not capture its individualized care, which happens, but we do like a documentation by exception. We know like how many cath are done and how many are treated well and how many readmissions and how many whatever. We have numbers on all objective things, but all these subjective things, patient-centered care, these data is not being captured. So that will not be part of AI, and we will lose all that part. So I'm just curious, like what are your thoughts about that? And the second thing is internationally educated nurses are coming to Canada for so many years now. We still have very complex process. Every province is inconsistent. Everybody is being dealt very differently. As a result, they are not seen as a valued partners. They are considered like they are here as a challenge, as a problem, as a liability, receiving of all the resources kind of optics. Whereas they bring so much strength to Canada, they become integral part of Canadian healthcare system, but they are not seen like that. So when they are not valued partner, optics are different and they cannot do their best. We have great AI, but how can this AI can help us to bring some consistent process or system by which we can bring more awareness to public, to employer, to decision makers to consider, and then have a better environment for nurses, for patient experience. Thank you.
Great questions. Maybe I can,
please, go ahead.
Take a crack at it. In economic theory, there's a concept called the marginal rate of return of information. So basically what that means is that when you take a look at model performance, statistical performance of models, as you increase the number of data points you have, the model performance increases to a point where it just plateaus. So if you add more data, it doesn't make a difference. And then if you keep adding a lot more data, it actually starts decreasing in performance. So we have to kind of wonder about what the AI really needs. And in many cases, the argument is it doesn't have all the data that we see. In many cases, it may not need all the data you see, right? And in fact, it's less noise for the AI. But it's very situation dependent. Now, if we take a look at how humans function, we have 5 senses, right? And essentially, we are data machines, right? How we perceive the world is because we see things, we hear things, we smell things, we taste, we touch. All of that is going into our head and it's processing. A machine can do that faster than we can. It can do it better than we can. Now, how much does it need? I'm going to go back to that question. I told you about the AI system that predicts if somebody's going to die, right? So we found that 150 to 170 different parameters is all it needed to perform well. What does well mean? So when we were actually developing the algorithm, our internist came to us actually with the problem and said, could you help us with this? And I remember the meeting. There were 17 internists in the room. And we asked the question, well, you want us to help what you do. That's your one job, is to help people not die. How good are you at it? And the doctors would say, most of them would say, we're terrible at predicting if somebody's going to die. But there were 3 or 4 of them who said, I'm so amazing at this. I'm so good, I don't need AI. So we had to actually take the journey on. And we said, all right, let's ask our doctors, nurses, and our residents. So we went to the floors to do this. And we asked our doctors, this is not a hypothetical case. And we asked our nurses as well. This is a real case. You just finished rounding on this patient, so you know them very well. Tell me if they're going to die during this hospital stay. Because you're asking us to build an AI solution that'll predict it. We collected over 3,000 clinician predictions. When a physician says this patient is going to die, any idea of how often they're right with all the information they have? Any guesses?
2%.
2%? Well, you're very cynical. Less than a third of the time. Less than 33% of the time. It's about 31% of the time they're actually right. Right? How many of the deaths do they capture? About the same. So what that tells us, and actually the funny thing is the ones who are more confident tended to do the worst. So what that tells us is we're not very good at this. So how much information do we have, and how good are we at this? Just to give you a sense, the AI that we created, 31% or so for the doctors, over 70% for the AI. Based on 150 to 170 parameters. It didn't need more than that. So it depends on the context. It may not need everything we think it needs. Now, where things are going, and I'm going to be trying quick about this, is if you look at the Ottawa Hospital, if you go there, in their patient rooms, now they have infrared cameras. Why? Because the cameras are able to actually not see the face or anything, but they do a heat map of the body, and they know when the patient gets up, they're a bit wobbly, the gait's not quite there, high risk for falls. What have they done? They've given AI the gift of sight. AI can now see. AI scribes are out there, right? AIs can now hear. So you can imagine humans have 5 senses. What if AI starts having those 5 senses? And it will. You'll see more cameras. You'll see more AI scribes. It'll start to have the data that we have. And remember, AI doesn't forget anything, and it can process things way faster and better than we can. That's where we're headed.
Just a very quick add-on, just a little bit different point of view. I currently work in Yihong, which is a Chinese long-term care organization. They have 5 homes, and they have a whole division of home care, etc. And most home care, and we follow the CIHI data. I don't know if you're familiar with CIHI, the Canadian Information Health Quality Data. And what we have found, CIHI, it's a very Chinese, 90% of the staff are Chinese, they speak Cantonese, and very culturally oriented homes. And what we found is that we are beating all the statistics out there, okay? So normally in long-term care, life expectancy or length of stay is about maybe 2 years, 3 years max. They come to Yihong, they live forever. I mean, I'm being half facetious, but honestly, that touch, feel, that, something that AI can never replace, that human kind of, that quality, that interaction, that social isolation is gone. They speak in their own language. They have their own food in their cultural whatever, I have Chinese noodles coming out of my ears now. And they have like 3 entree courses for each meal, choices, etc. That care cannot be replaced. So there is still room. I 100% agree with what you're saying. There is that kind of camera-induced, AI intelligence, etc., but you can't beat the human touch. And honestly, I'm shocked at what I see at Dihong. I really am. I'm in awe of what they are accomplishing. Now, mind you, they can't speak English, the staff, which is a real problem for me. But anyway, that's how it is, And talking about foreign grads, let me tell you, the need is so acute. There is a real war for talent right now, And we are bringing in boatloads of Chinese from mainland as well as Hong Kong. They do their PSW certification, and we hire them. So that problem is going to find a natural solution, because it's like the midwives and the OBGY physicians, they wouldn't let midwives come into the hospital to give births until they were fed up of doing on-call. Now come on in, because we can't be bothered to come in at 3 a.m. to deliver babies. So these are natural adjustments that are going to be made in the workforce.
Thank you very much. That was a very insightful answer. We have time for one quick last question. Anyone want to slip me a $20 bill to pick them? I'll pick you.
There's 6 questions.
Oh my goodness, I don't know. You know what? We'll go way in the back there. One of you two. And sorry if we didn't get to your question. Maybe, I don't want to speak out of turn, but maybe we'll try to hold another one of these, because the attendance, give yourselves a round of applause. It was incredible. All of you showed up in such large numbers. It was sold out like that, so thank you. And I think, do we have your blessing to hold another one of these days? Okay, gentleman in the back, what's your name and who is this question for?
Yeah, so I'm Roman Merchant. I'm currently a student at the University of Waterloo. And this is just a question for everyone, I guess. And it's, if you were a 20-year-old student and you wanted to break into the health space, what would you be doing right now? Would you be trying to learn new skills, or is there any specific products or startups that you would want to look into?
So you're assuming they're not 20?
Yes.
I don't know, man. Sorry.
Pretty close, though.
I think the world is your oyster, frankly. Like President Saiba said earlier, right? Who thought that data nerds would come into the hospital? The types of,
Why are you pointing to me?
It's because you call me arrogant. She's on my side. You hear that?
Honest to God, really the field is now blown wide open. There is so much opportunity. It's what Confucius had said, right? Find something that you love and you'll never have to work a day, okay? So find what is your wheelhouse. Where is your, strength, right? And then go deep into it, because there is an avenue in healthcare for it. I can guarantee you. Whether it's in, like you said so well, I think you should have been on the panel here, because all the future, careers can be found in healthcare now. It's wide open. And I met somebody downstairs who's doing urban planning. Well, guess what? We are developing like crazy, building nursing homes like crazy. You need urban planners. You need all kinds of aesthetics in how you get, your kind of nature into the world of long-term care, etc. So I would say, fear not, there is space.
Beautiful answer. I'm sure that gives a bit of hope. Do you two want to chime in on that?
Sure. I think Asmita said it really well. Nothing much more to add from me.
Yeah. The one thing that I'll add is if I was 20 years old,
Such a long time.
Yeah, such a long, oh my gosh.
You both are just taking shots at each other on that.
It's okay. We go back. I think, and Hazrat Karim Shah actually said this as well, cross disciplines, that's what I would do, is take two very different disciplines if you can. I'll give you an example. So my own example, I mean, I've got 3 different degrees in things that seem very disparate, right? But to bring them together is actually pretty unique. One of the people we hired was an artist in a hospital doing data science.
There you go.
So he was an artist who did a Master's of Science in Applied Computing and another Master's in Human Technology Interaction. Critical to the group. He's making a lot of money because he recently left us to go somewhere else, but he brought in the art side and brought in technology in ways in healthcare that we wouldn't have imagined before. And he makes our solution so usable because he brings in those different perspectives. So I would kind of carefully carve out, what am I going to do for undergrad, but what I do for grad may be very different than what I've done in undergrad, and I'm going to cross the disciplines.
Okay, great answer. And that brings our time to a close. Please, a warm round of applause. I mean, I told you they were rock stars. And did they deliver or did they deliver? A standing ovation. That's how good you guys were.
I think they're getting up for VP.
Yeah. I think they all want to leave very quickly. That's probably it. No, thank you all so much for attending. Once again, you guys showed up in huge numbers. This event was sold out so quickly. I know it was because of me, but please thank your panelists as well. What we'll do now is throw to Noah Premji. He's the Aga Khan Economic Planning Board for Toronto, the honorary secretary. So Noah, please come up here and give us some words of wisdom, because I know we didn't get it tonight, right?
Bismillahirrahmanirrahim. Institutional and Jamaati leadership, our wonderful panelists and moderator, distinguished guests, our dedicated volunteers, Ya Ali Madat, and good evening to you all. For those of you who don't know me, my name is Noah Premji, as Kamil took from my script, and I am the honorary secretary for the Aga Khan Economic Planning Board for Toronto. I'm also one of the people standing in between you and chai, and I know that won't earn me many brownie points, so I promise to keep this very short and sweet. Joking aside, I'm honored to be standing here right now to offer some closing remarks after an incredible panel session and evening it has been so far. On behalf of the Aga Khan Economic Planning and Health Boards and the entire Council for Toronto and Canada, I want to express our deepest gratitude to our esteemed panelists, Dr. Mamdani, Karima Karmali, and Asmita Gillani, for sharing their remarkable journeys, wisdom, and forward-thinking perspectives with us. Your contributions to healthcare in leadership, innovation, equity, and service are not only inspiring, but transformative, and we are honored to have had the chance to learn from you this evening. To our moderator, Kamil Karmali, thank you for skillfully guiding us through tonight's conversation and for helping us dig deeper into the questions that truly matter. Tonight's dialogue reminded us that the future of healthcare lies not only in technological innovation, but in the power of empathy, in the importance of inclusive leadership, and the role each of us can play through service, knowledge sharing, and community collaboration. Whether it's AI revolutionizing clinical decisions, or global initiatives expanding access to underserved populations, we've seen how leadership grounded in purpose can create lasting impact. We hope our guests tonight took at least one learning away that they can act upon in their day-to-day lives and career aspirations. This evening would not have been possible without the dedication of many. A sincere thank you to the organizing team, our tireless volunteers, and all their support teams, who always work behind the scenes to bring these visions to life. Speaking about our wonderful volunteers, The Council for Toronto is looking for support in multiple areas, such as our career ready, employment, housing, and healthcare initiatives for our newcomers. Please meet one of our representatives during the networking period to learn more about how you can join our team. You're welcome, President Nimira. Lastly, thank you to all our guests for your presence, your engagement, and your commitment to building a healthier, more equitable world. We hope tonight has sparked new ideas, new connections, and renewed energy for the work ahead. Please continue the conversations, enjoy the chai and cake very shortly, and most importantly, let tonight be just the beginning of deeper collaboration. Thank you again for being with us, and I'll pass it back to our wonderful MC, Ali Bolji.
Thank you, Onsek Noah, for your thoughtful reflections, and also thank you to our esteemed panelists and moderator for your support this evening. At this point, I would like to request President Saiba Nimira and Onsek Noah to kindly present a small token of appreciation for our wonderful panelists and moderator. I'd also like to take a moment to extend our heartfelt thank you to all the volunteers who have made today's event possible. A special thank you to the ICT hospitality team, IV team, AV team, and many others who worked tirelessly behind the scenes to ensure everything runs smoothly. Your dedication is truly appreciated. Thank you again to our speakers, to all our participants, and to everyone who made today's event a success. We will inshallah see you at our future summits and galas in the coming months. Stay tuned. Have a wonderful rest of your evening, and Ya Ali Madat. Thank you.